So today I wanted to talk about heel spurs. There's a couple of heel spurs that can occur. This is a picture of the calcaneus, or your heel bone. On the bottom of the foot there can be a heel spur, and there can be a spur at the back of the foot. The most common area that people talk about having heel spurs is on the bottom. And in reality the spur really isn't a problem because it is following the bottom of the foot. If it were pointing down towards the ground and it was a spike, it would poke and hurt and give people pain. But this comes out the side, and the bottom of your heel actually hits before the spur does. So usually when you're having pain on the bottom of the heel, it's due to plantar fasciitis, which is this band called the plantar fascia that stretches from your heels to your toes and helps support the arch, and it'll become aggravated and inflamed. So usually when people talk about heel spurs, it doesn't mean surgery, but there can be a spur at the back of the heel that sometimes does need pain. And the spur at the back of the heel will be called a retrocalcaneal exostosis, retro meaning back of the heel, and calcaneus meaning the heel bone. Exostosis means spur, and so it's a retrocalcaneal exostosis. Now the problem with that is the Achilles tendon comes down and attaches to the back of the heel. And often the Achilles tendon will be tight and pull on the bone, causing the spur to form. And it's the body's way of lengthening the tendon and saying, hey, instead of having to go all the way down here, what if I just have to attach up here? Now, often for the retrocalcaneal exostosis, or the Achilles tendon, we can do anti-inflammatories, physical therapy, and oral steroids to calm the inflammation down. But sometimes we have to do surgery, and that surgery means we have to detach the Achilles tendon and reattach the Achilles tendon utilizing screws, washers, or soft tissue anchors. And so what you look at is sometimes that spur will require surgery, and it is a little more complicated, but we can try all the conservative measures first and then proceed on to surgery. So that's just a little bit about heel spurs. If you have any problems, call Watkins Foot and Ankle Clinic at 352-805-4317, and we'd be more than glad to see you and discuss any type of pain that you may be having down around your heel.